I'm ever so slightly livid. And I also just frightened my birds there, I think. I want to talk to you about my doctors and a pharmacy which will remain unnamed. For nearly 60 years, the National Health Service in this country has allowed people with long-term medical issues to be able to get their drugs on a repeat prescription without having to book to see a doctor every time they run out of medication. The reason that is because the country, the NHS has to serve the whole country, and any way it can free up medical appointments so that people can get assessed rather than just be given something as a matter of bureaucracy is obviously of the utmost importance. Recently, a number of surgeries around Harrogate have sort of moved in together. This was part of an old Labour idea that things should basically join up, and this was extended to things like education and doctors and stuff. So rather than having 4 doctor surgeries, you know, around the town, they've all moved into one big building, which is slightly unsuitable for those who could travel to somewhere that was close, but now had to travel that little bit further. But that's, you know, beside the point. My surgery that I go to is called Park Parade, and it's now part of Mowbray Square, sort of doctors' conglomerate, if you like. And about a year ago, they told me, because I'm on repeat prescription for the medication that I'm on, and they told me when I went in to collect the repeat prescription from them, to take to the pharmacist to have it dispensed to me, that I could no longer do that. And what I had to do now was appoint a pharmacy somewhere around the town, and basically I would have to rely on these 2 multinational organisations, the National Health Service and the pharmacist, to talk to each other, to send scraps of paper between each other, so that I basically just went into my pharmacist when I wanted to when I wanted them to hand in my prescription, and then I'd come in a few days later after they'd handed it to the doctor had redeemed it and then handed it back for them to dispense it to me. Now obviously, whenever you're dealing with big companies, the first thing you should know is that they rarely talk to themselves, let alone anybody else. There are various departments in all these big national corporations that do not know what other departments in their same company are doing. Communication on the whole between a large institution is very poor. So then to expect them to be able to communicate with a different company and to send scraps of paper between these 2 companies is an absolute nonsense. And I said to them at the time I objected, because I knew that very shortly there would be some mix-up, somebody would lose a piece of paper here and I would be without pills, which would leave me suffering from whatever side effects there are. And there are side effects, you know. Some of the medication that I'm on, it's an antidepressant, but it's quite strong, and it can give you physical, rather unpleasant physical side effects if you just suddenly stop taking it. So I went into the pharmacy. It's been all right this past year, but I went to the pharmacy this week. I'm about a week before I run out of pills, to give them time. And I said to them, you know, it's time to hand in my repeat prescription. and they looked it up and they said there seemed to be some trouble. There always is. They're looking through endless books and books and books to find this little scrap of paper which has my repeat prescription details on it. And when they can't find that, usually they look on their system to make sure that there has been a repeat prescription thing set up, and then they can hodgepodge one together to send. This time they didn't seem to have any record at all, but they said they'd look into it, they'd send off what they found, and I could come back on Wednesday and no doubt my prescription would be there ready to be dispensed. Came back today, and of course the pharmacy denies all knowledge of knowing anything. You know, they haven't sent anything off, nothing's come back, because basically they've lost the little scrap of paper that has my repeat prescription details on it. So I went to the doctor's to book an appointment so that I could speak to the doctor to get him to write a new prescription for me so that I could then take it to the pharmacist and get it dispensed. Remember that I'm against the clock here, and remember that I'm also having to fit around their timetable for doctor's surgery hours. They're not open at weekends, they're not open on an evening, and I work full time, which gives us Monday. Anyway, thankfully, once I'd explained this to the receptionist, she found that she could, in fact, print off one herself and just get a doctor to sign it and then send it on to the pharmacist. So she said it should be there sort of Friday or maybe after the weekend, which is fine. But I'm not having this again. This is absolutely outrageous. So what I'm going to do now is forget the idea of a repeat prescription, and each time I need new pills I will make an appointment with the doctor in advance. I shall go in, I shall get him to give me the prescription there. I shall take it myself from the doctor's surgery to the pharmacist. I shall get the pharmacist to prescribe what they need, and then I shall throw away the repeat prescription, and the next time I need any more pills I shall make another appointment. I shall waste their time. I shall go in and I shall take these 10 to 15 minute appointments every few months to get a bit of administration done, because they can't just give it to me because of their own stupid policies about having to hand it between different organisations rather than just allowing people to come in and pick up a scrap of paper for themselves. I can trust myself, but I cannot trust them to give it to the pharmacist, and I cannot trust the pharmacist to give it to them. So when I want the pharmacist to hand something to them, for them to then fill out and hand back, I've got no chance. And I'm not taking that liberty with my health. So that's what I've decided to do. And sometime this year I will get called into the surgery, like I always do, to have an obligatory meeting once a year to make sure that my repeat prescription's okay and I should still be on the pills. That is when I shall actually speak to the doctor in person and say, you know, this is what I've decided to do, because I can't trust the administration between these two companies to work properly. I said to the person, right when she forced me onto this policy, that it was a disaster waiting to happen, and I told her then that I would go back and do it the old-fashioned way if it failed just once. It's taken a year. Bear in mind that I only hand these prescriptions in once every 3 to 5 months, so I've only done it 3 times through this stupid network of different people. It's not worked. And whilst this one's ended up, you know, okay, satisfactory, I'm not doing it again. I'm just not doing it again. So I shall now be booking a doctor's appointment once every few months to get a prescription to take to my pharmacist myself, and forget about the repeat prescription. I'll just go in and get a fresh one printed at a doctor's appointment every time I need one, because I'm not wasting my time. And I'm not putting my health in jeopardy like that anymore.